Solidarity forever. Solidarity forever. Solidarity forever. For the union makes us strong. Teachers power. Power. Teachers power. Power. Say power. Power. Autonomy power.
The health cover that teachers were given by the employer is not working for the teachers. First and foremost, there is system and efficiency failures. Many a times when teachers are in hospital, we are being told that they cannot be discharged because of the inefficiency of the system to pay those particular given hospitals. A case in hand is Bama Hospital, where a mother, a teacher who delivered and went through cesarean could not be released last week because the systems are down. Sometimes when the teachers go to the hospitals, we are told that the minimum balance is less than 20 shillings. Therefore, this results in delayed care, frustrations, and extreme cases of loss to life. We also want to say that hospitals are forcing teachers to co-pay together with SHA. This is because the minimum outpatient cover has been reduced drastically from 10,000 to 2,500, and now you are being told 1,200. The amount allocated per teacher is not enough for us to access medical. Doctors' consultation fee alone takes the entire amount. And then teachers cannot access laboratory and cannot access drugs. In some instances, we therefore want to condemn the low capitation and inadequate limits that are given to teachers. Limited coverage and missing services. In Siaya County alone, there are no services of dental and optical. And when you go to some of these particular given hospitals, they decline. And therefore teachers who are having eye problem and having dental problem are not likely to report to school next week because they are unable to get the lenses and are able to be assisted. Some of the hospitals that we are being referred to, which are the public hospitals, in and around Siaya, some of them, the equipment broke down last year and has never been repaired. For example, at Siaya Referral Hospital, the endocosmic machine broke down 1 year ago, has never been repaired to date. Yet teachers are referred to that particular given hospital from various sub-counties. Those particular given public hospitals accredited by SHA, the pharmacies are always empty. And therefore teachers are not able to get drugs. And therefore we are appealing that the scope and coverage must be expanded so that teachers can be able to get adequate treatment. We also have hospital-related challenges. Some hospitals reject SHA patients. Like in Bondo, the one that was being used by teachers, Harvard Hospital no longer admit teachers, both for inpatient and outpatient. Our attempts to get explanation from the SHA branch in Siaya has been futile. And therefore, those hospitals are demanding cash upfront, delay in treatment, and others opting out due to delayed reimbursements. Yet we are being told that the cover we have is a comprehensive medical cover. And as teachers of Siaya, tunasema hatutabebwa ufala. Walimu power. Corporate power. We therefore appeal that the government must find an alternative. The funding and sustainability crisis, where teachers' money are remitted to SHA, yet we are not getting enough services. And therefore, it now appears that even the autonomy net was better than the SHA that we are currently given by the government and the Teachers Service Commission. So we are appealing that the government must find an alternative to the teachers' insurance. And if they are not going to streamline the services of SHA, then the money deducted from the teachers' pay must be given back to the teachers, and the employer must insist that each and every teacher must be a member of an insurance cover. Walimu power. Walimu power. Poor emergency response. Here in Siaya, there is poor emergency response when it comes to treatment of teachers. Because the facilities that have been accredited by SHA, either they are not paid and there is low morale from the personnel, where some also complains that their salaries delay as a result of reimbursement from SHA. And therefore there is no response, no direct access to specialists, customer care lines ineffective, no ambulance support, yet we have a comprehensive medical cover. These are dangerous, and the net effect, loss of lives of teachers. And we want to say, as the schools are opening, that a sick teacher cannot deliver to our learners. We also have identified that there is administrative and policy gaps in SHA. Dependence coverage, where you and your spouse are deducted, yet you cannot benefit from the cover of your spouse. But the two of you are paying, and especially in teachers. So delays in claims and approvals, teachers detained in hospitals due to unpaid bills, this is something that we are not going to accept. And we are therefore joining the rest of the teachers of Kenya to give a warning to the government that if the following are our demands. The following are our what?
Demands.
The following are our what?
Demands.
1, that there must be policy and structural changes in SHA. There must be integration of teachers into public officers' medical schemes. There must be increase in capitation limits. They must restore the comprehensive cover in optical, dental, IVF, and ambulance systems. Walimu power. Walimu power. There must be system improvements to avoid delay and detention of teachers in public hospitals and private hospitals. So there must be improvement to avoid system delays. They must also fix the SHA digital system reliability for efficiency. The government must also ensure, and the SHA must ensure, that real-time approvals and claim tracking are done. We also demand that there must be facility expansion. We are appealing that there must be more on board private hospitals and faith-based facilities. We are also saying that as much as the government is accrediting public hospitals must be better equipped, and there should be availability of drugs. Not sending us to deathbeds in the name of public hospitals where there are no drugs. Na hiyo tumekataa kama walimu. Share power. Walimu power. And we are appealing to our SG that teachers are not going to take SHA down our throats as we see our colleagues dying and our colleagues getting frustrated because we are deducted and we are not getting services. If they fail to meet our demands, then the teachers will not have any other option but to down their tools, because sick people cannot go to work.
I'm Simon Otieno, Secretary JS here. We want to remind the government that the current active intern teachers are 44,000 and not 20,000. And we want to categorically say the courts already made a pronouncement that internship is an illegality. And we want to categorically say that the 44,000, underlying 44,000, must be confirmed to permanent and pensionable terms soonest possible. This is a song we have sung since time immemorial, and a time has come when should this fail to happen, we are going to be forced to join our colleagues in the internship to demand for their confirmation, and that would mean that learning in those junior secondary schools will not continue, because the teachers are demotivated. The pay itself is meager and cannot solve teachers' needs. So we are demanding immediate confirmation so that we can continue helping the government to midwife the junior secondary schools. Further to that, these JS teachers, up to now, we are in the 5th month. Some of them are yet to receive their pay. Their pay is little and it is not coming. We are demanding immediate pay and compensation of these teachers as their confirmation is being effected. We are calling upon the government, and we are also calling upon our members of parliament to include in the supplementary budget money for the confirmation of all the 44,000 JSS teachers.
I'm John Katoni. I'm the chairman of Corporate CI. As CI teachers and teachers of this country, we want to say that we are not impressed. We are not happy the way in which teachers are being treated in this country. We have seen a government that treats us as lesser public servants. The teachers went for marking for the national exams. The mega pay that they give us is even not being sent to us. The government is holding our money. And over 35,000 teachers who went to mark are still waiting for money 4 months down the line. And we are asking ourselves, why this? The process of paying us, the CS Treasury said he had released the money to NEC. We haven't seen money to date. Somebody somewhere is making over 10 million per month with our money, because that money amounts to over 1 billion. And when you keep that in a fixed deposit account for a period of 1 month at 1%, that gives you 10 million. These guys are joking with the teachers. Teachers are tired of this, and we are calling upon the government to ensure they give us our money before we open up the schools, because we'll not be working for them for free. This is a song we have sung, and we need our money with immediate effect. Even those who went to train the examiners have not been paid. Those who went to, those who supervised, those who invigilated have not been paid money. Yet we are in another circle. Those who set the exam that was done last year have not been fully paid. We are again in another circle of setting exams. What kind of a government is this? What kind of treatment are they giving to the teachers? We are saying we will not allow this to go on. On our junior schools, we have sung the song of autonomy.
Autonomy power.
And we are not relenting on that. Autonomy power. Power. Autonomy power. Power. We are saying our junior colleagues need the autonomous nature of operations. They need autonomy in management. They need autonomy in sports. They need autonomy on how they do their things.
Yes.
And we are telling the government, sitting in Nairobi and talking about junior schools operating in primary schools is not actually what is going on. The teachers are suffering. Some of these institutions, teachers are made to sit under trees. Teachers are made to sit in corridors because the inferiority that is affecting our hoys is really impacting negatively on our members. We are saying these are professionals. Some of them right now are in job group C3. Some are in C2. The people they report to are in C2. What kind of professional delegation is that? You cannot report to a junior professional. And we are saying this autonomy must come so that our members have a clear career progression guideline, how they're supposed to be promoted, how they're supposed to operate. But without this, we are seeing those who have stayed in those schools old enough are now demanding for accountability from their seniors. Because professionally, at C3, you can report to a C2.
Yes.
This will only be solved by autonomy. And we are calling this and we are saying this, and we are not missing our words. As teachers of this county and as teachers of this country, we are tired of this zigzag mindset of the government. You move forward, you come back. You go this direction, you go the other direction. We are saying we must get what is due to us. We are professionals, we are intelligent people, we know what our country needs to move forward, and that is what we are saying, that give our junior colleagues autonomy.